Hi everyone, so today we'll be discussing all you need to know about the Gardasil 9 vaccine. So what is the Gardasil 9 vaccine? This vaccine is given to individuals ages 9 to 45, although it is not recommended for those over age 26. The vaccine protects against 9 different types of HPV and is normally given in 2 to 3 doses. HPV is known to affect both males and females and is very common in the US, as around 79 million individuals are infected. It is the most common STD in the US. HPV may clear on its own without treatment, but may potentially lead to cancers, such as cervical, vulvar, and vaginal cancers in females, and in both males and females, anal cancer, head and neck cancers, and genital warts as well. So, what age is the vaccine given, and to who is it given? HPV vaccines may be given starting at age 9 to both boys and girls. After dose 1 is given, dose 2 may then be given 6 to 12 months afterwards. The third dose may be given 4 months after the second dose, only if the second dose is given less than 5 months after the first dose. For this vaccine, the earlier the vaccination, the better. This helps to protect your child long before they may be exposed to the HPV virus. For those ages 15 to 45 who are not yet given the Gardasil vaccine, they must be given 3 doses over a 6-month period for ideal protection. The ingredients in the vaccine consist of proteins from HPV types 6, 11, 16, 18, 31, 33, 45, 52, and 58, amorphous aluminum hydroxyphosphate sulfate, yeast protein, sodium chloride, L-histidine, polysorbate 80, sodium borate, and water, which is used for vaccine injection. Those who are pregnant or who have allergies to yeast or another component in this vaccine should talk to their doctor before getting vaccinated. The side effects with this vaccine are mild. Pain, swelling, itching, bruising, redness, and bleeding where the injection was given may occur. Headaches, dizziness, fever, nausea, and vomiting, and fainting may also occur as well. There are many common myths associated with this vaccine. There are some that believe you cannot be vaccinated if you were already infected with HPV. The vaccine actually protects against several of the most invasive strains of HPV and further protects against many cancers. Some believe you cannot receive the vaccine in the later teenage years, but it may be given up to age 45, and even then it still provides protection. Some believe this vaccine is only meant to protect girls, but males have a risk of anal, penile, and head and neck cancers if they are not vaccinated. Some believe this vaccine causes severe side effects and infertility in women, but side effects are mild, as with many other vaccines. And this vaccine prevents cervical cancer, which may lead to infertility and miscarriage after cervical cancer treatments. Some women believe if they stay up to date with their pap smears, there is no need for vaccination. Yes, pap smears are effective at finding cancer cells early on, but these do not prevent HPV like the vaccine does. Some believe this vaccine does not provide long-lasting protection, but much research has been done over the years that shows this vaccine is long-lasting, as after the 2 to 3 doses are given, boosters are not necessary. Research is still continuous, and over time we will continue to learn more about this vaccine. So overall, is this vaccine safe, effective, and does it provide long-lasting immunity? When vaccinating children in their early teens, this has the greatest impact on individuals and protects against uncurable cancers. It prevents against cervical cancer in women by 88%. The sooner the vaccination is given, the more effective the vaccine, and these individuals have longer lasting protection. Women vaccinated against HPV have a much lower risk of developing cervical cancer compared to women who are not vaccinated. With cervical cancer, after surgery and treatment with radiotherapy, this may cause difficulty or inability for women to get pregnant. The womb may then be damaged or even surgically removed. The ovaries may be affected and early menopause may occur. This may all be prevented by simply getting vaccinated. And now we will discuss the story of Anna. Anna is a 10-year-old girl who is in elementary school. She is a runner on a club running team outside of school and has made many friends on this team. Anna's mom was told by her daughter's doctor that it is recommended for her to obtain the first dose of the HPV vaccine, as this is recommended around her age. Anna's mom was skeptical and thinks Anna is too young, as she is not yet sexually active. Her mom is also afraid that it will cause side effects and may harm her daughter. Anna is now in her last years at middle school. She is on the track team at school and is one of the team's top runners. She has a very close friend on the team, Joe. Joe was also on the club team with her many years ago. They hang out after school every day and have been getting closer over the years. Anna and Joe are now in high school. Anna's mom has still been hesitant in getting her daughter vaccinated with the HPV vaccine. Joe is also not yet vaccinated. These two are always together. They have many classes together, hang out at practice. and are together at night too. Anna and Joe are now dating. They are now in college together. They got into an argument and have now broken up. Joe met another girl at school, but they didn't end up working out. After a couple months, Anna and Joe ended up dating again. While they were broken up, Anna didn't see anyone new, but Joe did. Anna's friend at school, Nicole, recommended that Anna should see her gynecologist as she knew that Anna was sexually active and not yet vaccinated against HPV. Nicole's mom had her go to the gynecologist once she started dating her boyfriend, Nicholas. Nicole had a pap smear done and she was told she had HPV. Her mother was scared after she saw that HPV causes cervical cancer, and she then got her daughter vaccinated. Anna called her mom and brought this up to her, and her mom still didn't want her getting the vaccine. After college, Anna and Joe got married and moved in together. Anna finds out she is pregnant. She goes to her first gynecologist appointment. She still has never had a pap smear and is still not vaccinated against HPV. The gynecologist tells her that she has cervical cancer. As she is pregnant, it is not recommended to undergo surgery, chemotherapy, or radiation treatment, as this would affect the fetus. Anna tells Joe, and he tells her about the time they were broken up when he was seeing someone else. As Anna has not seen anyone else, they were sure it was spread from the girl Joe was seeing when they weren't together. Unfortunately, both of them were asymptomatic, so it was not diagnosed early on. A biopsy was then taken from her cervix, which caused bleeding. The fetus was harmed, and Anna miscarried her baby. Anna underwent treatment after her miscarriage and was unable to get pregnant even years after due to the permanent damage of treatments. Anna's mother was so upset as she knew it was too late. Anna and her mother learned that she should have been vaccinated many years ago, when Anna's doctor and Anna's friend Nicole recommended her to get vaccinated. Anna is one of many individuals who did not obtain the Gardasil vaccine. Women must be aware that this vaccine is very safe and effective. Anna could be you. You do not want to end up like Anna. If you wish to get pregnant one day and don't want to risk losing your baby, or your baby being harmed, or being infertile, get vaccinated. Mothers, get your daughters and son vaccinated early on. Women not yet pregnant, get vaccinated now. The sooner, the more effective and the more protective. There are many myths associated with this vaccine. It is important to educate others about the importance of this vaccine and debunk these myths. Tell others about Anna's story, ask questions if skeptical, give answers to those who are skeptical, get vaccinated. Let's continue to protect our children and our future mothers out there.